Each of you has expressed a desire for the United States to accelerate the transition to renewable and alternative sources of energy. Beginning with Mr. Mielke, I'd like you now to explain what you believe ought to be the federal role in facilitating an energy revolution.
Well, first of all, I think we do need to do more drilling. We need to open up that opportunity. Oil is not just for energy. It's also for making products that we use every day, our glasses, our clothes, our carpeting. We're going to need oil irrespective of the energy crisis. The other thing is we need to open the door, just like Kennedy did putting a man on the moon. We need to put our efforts towards finding alternative energy, renewable energy, and put it to full scale. That's where that $700 billion should have been. That's where it should have went. So that we can have the money stay here instead of giving it to the Middle East, giving it to Mexico, giving it to other countries. Keep the money home, and maybe our economy will get stronger. Maybe if we turn around and look at that, and start saying, let's quit arguing. The Democrats say, I want to have solar power, and the Republicans say, I want to drill for oil. Why not say, let's do it all, get it done, get ourselves on board, and as soon as we get the alternative energy system up and running, that oil will still be used for products. For this idea, this kindergarten fighting back and forth and doing nothing is what caused the problem. If we'd have 30 years ago done that, we'd be in a lot better shape today, and I don't believe we'd have the problems that we're facing.
Dave Obey, you've got 90 seconds.
Mr. Mielke, you are absolutely right in that respect. If we were spending the same amount of money on alternative energy research that we were spending when Jimmy Carter left office, we wouldn't be in this position today.
So basically,
I'd appreciate it if I could finish. I didn't interrupt you.
The situation is, you forgot about some of the other qualities that you have brought. What about voting for this bailout and spending $700 billion? What about the fact that
the stock market went up 900 points today? Do you really think that that would have happened if we had not cooperated with the president to pass that package?
To take that loss, and that's where a problem comes in.
What would you suggest we do?
Well, I would suggest we start building our industry. I would suggest we start sending them overseas.
How?
Why didn't we do it? If we'd have done it 30 years ago, we wouldn't have the problems we have today.
I'd be happy to lay out why we haven't had proper energy budgets.
No, giving the money to them is not the answer.
What would your
Congress for the longest time
just like we got the regulators out of the way the last 20 years, and now we're paying the price.
Congress did nothing.
Well, with all due respect, you've been squawking for the last 20 minutes about what Congress did do. The fact is that when Jimmy Carter left office, his successors ripped up his budgets. Today we are spending about 1/3 to 1/4 the amount that we were spending on energy research when Jimmy Carter left office. Each year, Ronald Reagan cut the guts out of our alternative energy research programs, and George Bush has done the same thing. Each year, my committee has tried to restore those funds, but because he had the veto pen, we didn't have the ability to restore them all. We were only able to restore about 1/3 of them. This year alone, again, we tried to prevent the president from cutting $1.2 billion out of alternative energy research programs, research which today the president now says he's for, but which he was trying to cut just 6 months ago.
This is an open exchange.
This is. That's what I thought. But
Mr. Mielke, what do you see as the federal role in energy, in advancing, in pursuing, in helping the transition to renewable and alternative sources of energy? And I didn't really hear an answer to that directly.
Well, my goal was to actually work like we did when we put a man on the moon, put a unified effort of putting all of our resources together to try to get this to happen, to try to get our energy resources to increase in this country so we're not dependent on foreign oil or on foreign energy. And I believe that means we have to look at alternative energy such as solar, wind, power, hydro, LP, as Mr. Pickens has said. Brilliant idea. But you don't ever hear anybody in the debates talk about that. We need to start doing that. At the same time, we need to start building our own oil reserves and getting those things back where they should be and quit putting roadblocks in the way. First of all, the number one thing should be do is take the roadblocks out of the way so that business can do what they want to do. Secondly, where those areas do need a brief help, then I don't have a problem with that. I have a problem with subsidizing them when they're not producing. And so I think we need to work together. And I think if you get out of the way and let the American people do it and open the doors for them and open opportunities for them, we will solve that problem, and that'll also solve our financial crisis.
We're going to get on the topic of health care at this point. You're both familiar with the health care proposals that both campaigns have introduced here in the presidential race, and that makes it quite likely that Congress at some point here will see legislation come through within the next 4 years. Given that we don't know yet which plan that would be, I want your opinions each on about those plans. Do they go far enough, and can we afford them?
I think that health care is a right. I think every American has a right to whatever health care they need without begging for it. I will vote for whatever bill we can get 218 votes for in the House and 60 votes in the Senate so it can become law. I think Mr. Obama's plan is far superior to Mr. McCain's. It is based, it starts with the assumption that you can keep your employer-provided insurance, and it builds on that for people who don't have that kind of insurance. It also provides assistance to small businesses to enable them to provide it, and it sets up statewide pools or for people who still can't get into an affordable health care plan. The problem with President Bush's package is that the guts of it is essentially an agreement to provide for a health savings account. The problem is that if you don't have any savings, that doesn't do you any good. But you can't, for people who can't afford to put money aside now, it certainly isn't going to help them to have a health savings account. I think that one of the three top priorities of the coming Congress and the administration has to be to provide universal health coverage for every American.
Dan Mielke, you've got 90 seconds.
Who writes the check will not solve the problem of the high cost of health care. That's not a solution. That's just taking power and taking responsibility over so they can do what they want to do with the health care system. Under the present system, Medicare and Medicaid, hospitals are running about 74 to 75% of costs is what they get paid back from Medicare and Medicaid. They're running about a 25 to 26% loss. Who do you think makes that up? That's a 33% increase on everybody else, because 55% of all those Medicare and Medicaid patients are their patients, 55% of the total patient load. So that means we're seeing a 33% increase in our health care because the government got involved and tried to help. That's called a hidden tax. See, they don't actually charge you for it. What they just do is they don't pay enough out, and you got to pay it out of your pocket in your premiums and in your insurance and in your health care cost. That's the type of problems we have in Washington. And that same mentality is going to be the one that's going to run your health care. You know, if you get to the point where 100% are only getting 75% of cost, how long before the hospitals close? This is the problem we have. They're thinking always, you watch, every time they have a solution, it has to do with money. And where does the money come from? You and me. There are solutions that will change things. And the burdens that they put on the healthcare industry are raising the cost. The fact that we have 24 to 25,000 illegal immigrants draining our healthcare system is a problem that government and Mr. Obey has supported. We have to stop that. We have to start running government like we run our own pocketbooks and start managing and paying our fair share. And
Eric,
government needs to pay their fair share.
Yeah.
Eric, do you have a follow-up?
I do. Mr. Mielke here, you've pointed out some of the problems that you see. What do you see then as the solution?
Well, the first thing is what I'm getting at with the solution is you fix the problems. And as you fix the problems, you'll be able to find ways to make things work. You don't just cover them up with more money. And so my idea would be have the government pay the full amount. That doesn't put the burden then on just the medical profession to carry that load. If the citizens will see what is being spent and can do that, we're going to help deal with the situation by who we put in office. And that's going to change. But the idea of constantly spending is not going to solve the problem. What we have to do is find a way to bring the health care costs down so that I can choose the doctor of my choice, the hospital of my choice, the treatment of my choice. I don't want government, like Mr. Obey, telling me when to take my pills because he's got to keep costs down. You watch what government does. Look at their history. They'll get an organization. Look at Social Security. What do they do with your pot? Where is it? That's the problem. I don't believe it should be that way. I believe this private sector should have it, should maintain it, and we should open up the doors so they can have proper competition in a market and we can compete against it.